Hello everyone, welcome and thank you for joining us today. This presentation is brought to you by public health students at San Jose State University. We put this presentation together hoping to inform the elderly more about coronavirus 19 and learn more about the necessary precautions that they need to take as they're the most at risk. So a little about coronavirus 19. It is an infectious disease caused by a newly discovered coronavirus. The virus that caused COVID-19 was the first identified in Wuhan, China. It is a pandemic of respiratory illness that can spread from person to person. On March 11th, World Health Organization declared COVID-19 a pandemic as the number of infected countries grow, affecting the elderly with serious underlying medical conditions. As mentioned, this disease can spread from person to person, specifically through small droplets from the nose or mouth when an infected person coughs, exhales, or talks. These small droplets can also land on surfaces, which means any person that touches these surfaces and then their eyes, nose, or mouth can become infected.
Who is at the high risk of COVID-19? Older people with compromised immune system are at the high risk of serious illness. According to CDC, 8 of every 10 deaths in the US from the COVID-19 have been in adults 65 and older. It is about 10 to 20% seniors die when they infected to the COVID-19. The risk only increases with age. Also, people who have underlying medical conditions such as high blood pressure, heart disease, and diabetes are more likely to develop serious illness. The most common symptoms of COVID-19 are fever, dry cough, and shortness of breath. Some patients may have a few symptoms such as nasal congestion, runny nose, sore throat, and diarrhea. The symptoms may appear 2 to 14 days after exposure. Symptoms are usually mild and develop slowly. Most people, about 80%, recover from the disease without needing special treatment. Some people become infected but don't develop any symptoms and don't feel unwell. However, there is currently no vaccines for the virus, as well as COVID-19 have more respiratory symptoms than a flu or cold. So you can pay attention on the main symptoms such as high fever, dry cough, and shortness of breath. When to see doctor. Seek medical advice if you have COVID-19 symptoms, as well as if you live in an area with ongoing spread of COVID-19, or you have been in close contact with a person known to have COVID-19. Also, call 911 immediately if you have emergency COVID-19 symptoms such as trouble breathing, chest pressure, and new confusion like blue lips or face.
And now I will be briefly talking about how to wash your hands properly. As silly as this may sound, not a lot of people know how to correctly wash their hands. You want to make sure to wash your hands for at least 20 seconds or longer. You can keep track of this by singing the ABCs to yourself. Before washing, you want to keep your nails short, remove any kind of watches or rings or bracelets. You can use any kind of soap, antibacterial is fine, or even your regular soap. However, you must use soap along with water. Water alone will not help. After you wet your hands with water and apply the soap, you want to rub your hands palm to palm, and then on the back side of both of your hands, and then you want to rub your fingertips and also under your nails. Then you want to rub in between your fingers, and with your opposite hand, you want to clasp your thumb and wash it as well on both sides. And then many people forget this, but you also need to scrub your wrist. And after you've rinsed and dried your hands, you're all set. And now here are some everyday tips for COVID-19 prevention. As I said before, it's important to wash your hands with soap and water for at least 20 seconds or longer at all times. However, if you do not have access to this, carrying an alcohol-based hand sanitizer is also helpful. You want to make sure it is at least 60% ethanol or 70% isopropanol. In addition, you want to follow the stay-at-home order. Whether you are healthy or you are sick, you especially want to stay at home if you are feeling any kind of symptoms. You should only go out for essential activities. They should only be for groceries or work. You also want to avoid touching your face. This includes your eyes, nose, and mouth.
Some more preventative measures would be to cover your cough or sneeze with a tissue, which then you would promptly throw away in the trash and wash your hands. You could also sanitize your hands if soap and water are unavailable at that moment. If you don't have a tissue, please make sure to cover your cough with your elbow and not your hands. It is important that you frequently clean and disinfect surfaces or objects. This could be your house landline, your mobile device, or door handles. When going for essential trips, like to the grocery store, you want to make sure you are sanitizing the steering wheel to your car, the shopping cart, and your hands whenever you touch objects that are frequently touched by other individuals. This is definitely going to help prevent the spread of the coronavirus. You also want to ensure that you are avoiding close contact with individuals, especially those who are sick. This is just reinforcing social distancing, keeping 6 feet apart to help protect you from any contact with an individual who could have the coronavirus or be carrying the virus and not know it, being asymptomatic. This also includes any family members or friends who you do not live with. However, you are definitely allowed to call your loved ones or video chat with them. The CDC is recommending the public to wear face coverings when going out for essential trips, like to the grocery store. This face covering can be either reusable or disposable. You want to make sure that the N95 and surgical masks are saved for our first responders and healthcare workers because they are working very closely with the virus and need the best mask available to keep them safe at the front lines. The different types of masks that you can use when out in public can range from bandanas, reusable masks, disposable masks, scarves, or anything that covers your face and protects you. When you do wear reusable masks or facial coverings, it's important that you do not reuse them and instead make sure to wash them after every outing. You can wash your reusable masks or face coverings in the washing machine or by hand. While wearing these face coverings, you want to ensure that it's breathable, that you're wearing it whenever you go out in public, that the mask covers both your nose and your mouth, and as I mentioned earlier, please make sure to wash the mask after using it. This is a tutorial that shows you how to make a face covering that is a no-sew method. The only materials that you would need would be scissors and an old t-shirt that you don't need or don't care for anymore. At the very end of the said t-shirt, you would measure about 7 to 8 inches up from the bottom, which is where you would cut. From this piece that you just cut, you want to measure 6 to 7 inches lengthwise and cut that out, making sure that you leave a top and a bottom piece, as shown in the picture. These two pieces that are left will be the strings that you put over your head and neck, which will then keep the mask in place. Hopefully this tutorial will be helpful for you in case you are unable to find a mask, or if you were just wondering how you could make some reusable masks at home with materials you already have.
Now I will be discussing an array of graphs that focuses on coronavirus and the impact it has on seniors. As stated by the US CDC, they have gathered information on the amount of COVID-19 deaths by age. You can easily see as the age increases, the more cases of COVID-19 deaths arise. Individuals 85 years and over are affected the most as they carry the highest number of deaths out of any age group. While Italy and China were greatly affected by this pandemic first, the US shortly began to surpass these countries by heavily populated areas such as New York and New Jersey accounting for the most cases and deaths of COVID-19. According to Information is Beautiful, they have accumulated a variety of sources from the China CDC and the Italian Portal of Epidemiology for Public Health to generate these graphs. On this slide, this graph focuses on the percentage of COVID-19 cases in the countries of Italy and China, which then had the most cases during the beginning of the pandemic. As you can see in the top left key, Italy depicts the blue portion, whereas orange represents China. As the brackets of ages reaches towards 60 years old, which is highlighted in the orange, we can easily see how these elders begin to become more susceptible of getting COVID-19. Similar to the previous graph in the last slide, we can easily see that these countries' elders become greatly affected no matter the location they reside in.
Moving on to the next slide, this focuses on seniors with existing conditions. While individuals older than 60 years old are more susceptible to getting COVID-19, having pre-existing conditions increases their chances of getting this virus as their immune system is compromised by one of these illnesses or diseases. The list of diseases include cardiovascular disease, diabetes, chronic respiratory disease, abnormally high blood pressure, cancer, and with the last category representing those who do not have existing conditions. Easily, you can see that those who have cardiovascular disease are more affected by COVID-19, leading the other categories at 10.5%. Other categories average about 6%. Going to the following slide, you can see that there are two curves, the orange representing a high fatality rate and the other representing a low fatality rate. Between the two, the blue curve maintained below the dotted line is what we want to strive for and maintain as a society. Some factors that could increase the curve could contribute to people not social distancing, not sheltering in place, getting infected, or hospitals not being able to provide enough beds and workers for those sick individuals. With the government issuing shelter-in-place dates, this will not only help flatten the curve, but it will also assist with reducing the numbers of cases of coronavirus across the nation. Here is a map of California representing the areas that are affected by COVID-19. As you can see, there are circles of different sizes across the state. These sizes represent the amounts of cases within these areas. The larger the circle equates to more cases. As of April 2020, California has about 42,000 cases. You can visit California Department of Public Health's website to follow an updated version of the amount of COVID-19 cases in California.
Due to the total number of COVID cases in California, there is a statewide shelter-in-place order from the county's health officer. Shelter-in-place means to stay in your homes and do not leave unless if it is necessary. All residents must comply with these restrictions, and it is mandatory. This order is legally issued under California law and is considered a crime or misdemeanor to not follow the order. You cannot leave your homes to visit friends and family that live in other households without an urgent need. This is to prevent spreading the disease for the safety of you and your peers. You can go on walks around your neighborhood, but keep around a 6 feet distance when you see others. Grocery shopping is still permitted for buying essential resources, but other stores selling non-essentials are closed. Our resource guide provides services that are catered to help seniors get the proper care and resources they need. The following grocery stores have dedicated time frames for seniors, pregnant women, and immune-compromised individuals. Safeway and Albertsons Market dedicated Tuesdays and Thursdays from 7 a.m. to 9 a.m. for these individuals. Target and Whole Foods Market dedicated Wednesdays from 8 a.m. to 9 a.m. And lastly, Vallarta Supermarket is open daily from 7 a.m. to 8 a.m. for these individuals. We have two resources that help buy and provide food for seniors. CalFresh is a program that provides a budget for low-income communities to afford healthy and nutritious food on their table. They are offering to help seniors buy food. You can apply for this service with the link provided below. The Second Harvest Food Bank falls under the same principles of providing healthy food in their communities for the people that need it. They are also providing the same services of buying and providing food and can be reached through the phone number provided below.
The Institute of Aging 24-hour toll-free friendship line is an accredited crisis line for older adults and adults living with disabilities. Specialists at the friendship line offer the following services: emotional support, elder abuse reporting, well-being checks, grief support, active suicide prevention, and information and referrals for isolated individuals. Simply call the friendship line at 800-971-0016. In partnership with the Governor and the California Department of Aging, AARP has launched the California for All Resource Card. It's a one-stop information guide on COVID-19 for all Californians. The resource card includes information on how to get caregiving support, how to stay safe at home, how to find important resources through the California Aging and Adults Information Line, contacts to report fraud, abuse, neglect, and more. The card and listed resources are available for free to all Californians. The Santa Clara County Social Services Agency continues to help enroll residents into programs that provide cash aid, food assistance, and healthcare. For more information, please see the attached flyer or call 1-877-962-3633. Thank you for tuning in. Included here is a QR code that directs you to the California Department of Public Health's website for updates on COVID-19. Simply use your smartphone's camera app to scan the code or copy the URL into your internet browser's address bar. And lastly, please help us by completing a follow-up survey. Again, just use your smartphone's camera app to be directed to the survey or copy the URL into your internet browser's address bar. Thank you again. Please stay safe and stay healthy.